Thank you for joining us again for another conversation on hope. Today we'll be talking to Dr. Gilcrease, who is an oncologist at the Huntsman Cancer Institute in Salt Lake City, Utah. So let's just jump right in. Thank you for being here.
Thank you for having me, Addie.
Yeah, I'm so glad you're here because I feel like you will offer such an interesting and different, unique perspective on hope as you work with terminally ill patients and people all the time. So tell me about the different types of patients you encounter in your practice.
Well, so I'm a medical oncologist and I take care of predominantly patients with what are called gastrointestinal cancers. And I see an array of different cancer types, but most of them, like you said, are terminal cancers. As far as the terminally ill patients, I think that's what you're getting at. What types of terminally ill patients do I see? I think it's important to, from my view, I think some of the important elements that I see for my patients and how they do really is how active and how connected do they stay in their lives and how connected do they stay with those around them, but also with what they do and what they enjoy doing. I think an important element of that is hope.
When you are looking at, and I agree with you, because I think hope and a good attitude going into an illness like cancer where you might not know what the outcome will be when you start, but when you're looking at like the data and the sheets and the test results, and you see that things aren't going well or things aren't looking good, how do you keep that hope alive in your patients, or do you feel like that's even your job at all?
Yeah.
To keep
no,
hope
I think it's absolutely one of the most important pieces of what I do. I think so. If I see the patient in the computer or the electronic version of the patient before I walk in there and I know things don't look like they're going well, I think one of the most important things that I can do is offer a positive outlook on it, and how can I get them to continue and to, like I said, keep engaging really in their life. And I think that's such an important element of how patients do. If they disengage or if they lose, I think that optimism or that hope of another day and another good day, I think you can often lose a patient. So I think some of the ways that I do that, I think it's always important to try to understand where a patient's at. What are their fears and what are their hopes? And so as I'm sort of gathering the information and then trying to convey that information, I think one of the most important things to do is I try to walk in as sort of a blank slate and try to get a feel for where they're coming from. And then I look at my job as to try to guide them into hopefully an optimistic path and a hopeful path. And I think that can be, well, let's try another treatment, or let's go in this direction, or let's address this specific issue. And sometimes, unfortunately, it's let's stop treatment and let's really focus on your symptoms and trying to get you better. But I think either way, trying to really convey that message in a positive and a hopeful way is absolutely what I try to do. But I think you can't do that unless you really understand who you're sitting and talking to.
So to go a level deeper in that, do you think that hope and faith and this engagement is just a placebo effect, or do you really think there's a connection between the scientific and the physical, emotional, spiritual side of a person? Is there a connection there, or is it just all in their heads?
Yeah, that's I think one of the most important questions that you're asking. I think Western medicine has traditionally said placebo is something that's poorly understood, but it's very real. So if you look at any study, you will almost always see a placebo response. It depends on what the study is and what the medication is for, but you will almost always see a placebo response. In fact, even when there have been studies where they've given patients a treatment and they tell the patient this is a placebo, and they still will have a response. So we sort of, I think placebo has this shade in Western medicine of it being kind of fake or being unreal. But it absolutely is real. You absolutely do see responses, whether it's measuring blood pressure or whether it's a survey and measuring different elements of patients' overall well-being. You see responses. I personally think that, those are very real issues, are very real elements of a patient's care. So things like hope, things like compassion, and things that are very hard and maybe impossible to measure are absolutely important and absolutely critical to a patient's overall health status, but how they do especially in what I treat, the terminally ill cancer patient. I think it's absolutely important. But how do we understand it? That I think is more difficult.
So what do you think we can learn from Eastern medicine? Because they kind of came out of more of the spiritual realm, where Western comes out of more of the scientific realm. So what can we learn? And if there is that connection between the two, where do we go from here in the West? Like, what can we learn, and what is there to learn, and can we bring some of that together? Is that happening? Do you see that happening in the future?
I think there's a large proportion of physicians and patients. If you look at patients, most studies would say at least half of patients are interested in something that the doctor hasn't prescribed, which is typically an herbal medication or some other treatment that isn't considered, I think, traditional and Western. Yeah, I think it's something that there's a lot of interest, and there's a lot of interest on the patient side, and there's a lot of interest on the physician side. I also think that it's tough to take a system like traditional Chinese medicine and try to understand it and try to probe it and try to measure it with a Western system. It's almost like, to me, it's a little bit like having a tablespoon and saying, well, tell me what the volume of the ocean is. Well, it's not the right tool to measure the volume of the ocean. And so I think sometimes the tool to measure Eastern or traditional Chinese medicine, we don't have the appropriate tools to understand it. Do I think that Eastern medicine has important things to teach us about taking care of a patient? Absolutely. And do I think that their basis for understanding both health and illness is different? Yeah. I do think eventually you'll see them merge. We've made a lot of advancements in Western medicine. Our understanding of, even in the last 5 years in oncology or in cancer treatment, our understanding of how the immune system plays a role in cancer development, but also in cancer treatment, has really skyrocketed. But you're still missing this other piece. So I think as we start to understand more about this sort of material world through scientific avenues, we also have this other piece that I think is really critical to taking care of the whole patient and understanding the whole patient.
So is that, but that's not part of the regimen right now for like medical school, right? Like
Right.
you don't take a semester or a quarter or whatever.
That's right.
And travel somewhere to interview or talk to
Yeah,
people.
that's right.
So we're relying on people to bring it to us in the West. Is that correct?
Yeah, there are programs sprouting up around the country. I think there are even some of the large cancer centers, like our cancer center, we have a wellness program that is interested in using things like acupuncture and things like massage and things like guided imagery and some of these other techniques that I don't think are considered traditional Western medicine techniques.
Right.
And I do think that you're seeing more of a collaboration of both types of medicine being practiced. And I do think you're seeing more of an openness from the medical community in trying to adopt and understand these. I really do think that it's important to be open to all possibilities. I mean, I really think that's probably the basis of what hope is. Hope to me is saying there's an infinite number of possibilities and any of them could happen. And that includes the impossible or the seemingly impossible.
Right.
And so, I think if you want that wide array of possibilities, you have to be open to not just quote unquote our way of doing things or the Western way of doing things.
And do you think that there will be easier avenues to find those traditional Eastern methods in the future? I mean, I know Huntsman has a good wellness center, but they're sprouting up all over. I mean, it's kind of a trend now, right? Through the country.
Yeah, I think it's a trend because it's valuable. And not just, to go back to your question, not just valuable because of some placebo effect, but again, I think this placebo effect is something very real. It's just something that's poorly understood by us. And just because it's poorly understood by Western medicine doesn't make it unreal or unimportant. So I do think that you're seeing more interest, not just because we've hit a wall, which I don't think we've hit a wall in Western medicine. I think we still are making lots and lots of advancements. I just think we're losing this kind of human element. I mean, as a patient becomes more and more what we see in a computer and what we see on a piece of paper and less about who I'm walking into and talking to, I think you need both pieces. So I don't think that this kind of electronic version of the patient, so to speak, is unimportant. I just think it's a very small piece of the whole picture. And I think for us to broaden our horizons and again be open to any of these possibilities, I think that will create for better medicine. We were talking before about meditation as an example of something that I don't think was well understood or maybe even believed in by Western medicine, but there's been in the last, especially 10 or 15 years, with something called functional MRI, where we can actually measure the pathways that are being activated and stimulated in the brain, and we can see those change with meditation. Now, meditation, just sitting quietly for 30 minutes, you would say, well, how is that going to actually change the physiology of the brain? But we can see this now, and we can measure it. So to me, this is a good example of how something that we can take from Eastern thought or from traditional Chinese medicine can actually start to be measured and start to be evaluated by Western medicine, and hopefully then be adopted as something that's a real possible construct to help our patients.
And would it be even more beneficial to be proactive about that instead of starting like after you're sick?
Yeah,
in the diet and the meditation, in the massage or whatever that is, the herbal remedies.
I absolutely, I really tried to, again, if I'm walking into a patient's room and I get the feeling that they're very interested in that, I really try to support that. I think especially if you try to do it in a safe way where I know what they're taking and our pharmacists know what they're taking and what they're using.
Right.
And also, if something works remarkably well for somebody, then I can use that for other people as well. But yeah, I think, and I think what you're getting at is a patient being proactive about their own health and what's going on with them and sort of taking charge of their own life and their own health. Some of those patients do by far the very, very best, especially the ones that, again, stay engaged and stay with themselves, stay with the world around them, and stay connected.
Stay with what makes them happy and joyful and
Yeah.
hopeful.
Yeah.
Right. On a personal note, what made you decide to go into medicine?
Yeah, it's a good question. So in college, I was a math major with a computer science minor, and I really didn't know what I was going to do. I also was studying Spanish. And I was always looking for something. I liked the intellectual side of mathematics. It was kind of clean, and there was always an answer.
Yeah.
And then I think Spanish was really more about trying to converse with somebody else and understand a whole nother population of people. And I was always kind of looking for both of these. So I think as I went on and on in college, I started looking at the world around me more in a mathematical sense. And I think there was some part of me that was really lost. And then towards the tail end of college, a friend of mine was diagnosed with lymphoma. And going through the process of her treatment and really her cure from Hodgkin's lymphoma, I became very interested in medicine as an avenue to connect that intellectual piece with that emotional piece and say, geez, there's this whole human part of really knowing what a patient's going through. Because with her, I got to see what happened when she left the doctor's office.
Right.
What happened when she had to give herself shots, or when she had to go through radiation, or she felt terrible, or she lost her hair, and what was she going through, and what was her impression and her thinking about what was going on. And it was really an incredible experience for me, and made me want to pursue medicine. And that was my last semester of college, so I had to go back and take all my pre-med classes, and then I went back to
So
medical
did
school.
it work out well for her?
Yeah,
Oh,
she's
good,
she's still doing well. She lives in Phoenix, Arizona, and
Excellent.
has a young daughter and is doing well.
And through her treatment, did she have a good attitude? Or being so young, I would think that would really kind of knock you off your rocker. And
That's a
being
really
in
good
college.
question. Yeah, that's a really good question, because I think that had a deep impression on me, watching how she handled it. And she really did have a way of saying, I'm going to keep going along, and I look at this as just a little bump in the road, and this is not.
Wow.
I never saw her feel sorry for herself. I really didn't, and it really had a profound effect on me watching this psychology. Maybe not completely understanding it, but watching how somebody could. Because I remember thinking, this is not how I would handle it. I mean, for me, it would be, woe is me, and look how
Really?
look what I've been dealt. But she really had a way of never getting into that mentality. She kept working, and she really stayed engaged with her friends and her family. And I think that was a big part of her getting through it. She really had a way of. She loved sunflowers, and I think that was kind of the symbol, just this kind of bright outlook. That wasn't, it wasn't false. It was something real and deep in her.
I'm happy. I'm happy that
Yeah.
turned out well. Where do you find your hope, your personal hope?
Probably my spirituality. I think in the clinic and in the hospital, taking care of really sick patients, it can be really tough.
Right.
There are times where
I can imagine.
it's and it shakes your faith. It shakes how you view the world. You see some of the things that seem from my standpoint very unfair for people and their families. And so I think that I think my faith has been a really important piece of my own hope. And I think saying I can't understand all of the reasons behind what's happening, but I know somewhere deep down that this universe is a compassionate universe, and that everything is happening for maybe some reason I don't understand. I think that's really important for me. I meditate a lot too.
Sounds like you practice what you preach.
I try to. I try to. I think one of the things is, even for patients that I'm going through this very difficult process with, it's okay sometimes to lose your faith and lose your hope. And I think sometimes when you're open with it, you can get back on the right road.
Mm-hmm.
And I think some of the patients that absolutely don't even want to look at it and just say, no, I won't even be open to the idea that I don't have hope. I think they're trying to convince themselves that everything's going to be okay. But I think you really have to, I think sometimes you have to just be real honest with yourself and say, gosh, this is hard.
Yeah, it is. Well, this is great. Anything else you want to add?
Well, no, I do thank you for bringing me here. I think the one thing that I will say is, I'm often the one that's just watching this happen. And I do understand that, I'm not the one that's having to walk in these shoes. So I think for me, I think one of the most important things that I can do is try to be a kind and compassionate a person along for the journey for all of my patients.
Well, that you are.
Well, thank
You
you.
certainly have been a blessing in my life. So
Yeah,
thank you
likewise.
so
Thank
much.
you.
Yeah. Thank you so much for being here.
Well, thank you for
Appreciate
having
it.
me.
You've really opened up a unique perspective, I think, that a lot of people will appreciate.
Great.
So, good.
All right, thank you.
Thank you.